Hi, I'm Dr. Caroline Tadros, a gastroenterologist at Kaiser Permanente. Today I'd like to talk to you about a common condition, Irritable Bowel Syndrome, or IBS. So what is IBS? IBS is a very common condition that is estimated to affect up to 20% or more of the population. IBS is a functional GI disorder. A functional disorder is a condition that produces chronic, recurring symptoms despite the fact that the organs are normal, healthy, and are working correctly. Conditions commonly associated with IBS are fibromyalgia, chronic fatigue, depression, anxiety, interstitial cystitis, and a history of abuse. Because there's nothing wrong with the structure or function of the digestive organs, it is not a disease. It is very important to understand that IBS is not a product of a person's imagination. The symptoms are real. Most of us have experienced stress-related GI symptoms at some point. It's common to experience nausea, diarrhea, lack of appetite, or the sensation of our stomach being in knots before a big test, big life event, or public speaking. In IBS, symptoms are present for at least 6 months and occur at least once a week for 3 months, and are associated with 2 of the following. They're related to bowel movements. There can be a change in the appearance or the frequency of the bowel movements. Symptoms of IBS are abdominal pain, usually cramping and bloating, with diarrhea, constipation, or both. The symptoms can be very distressing and disruptive. The passage of mucus is common. The intestines make this mucus to coat and protect the lining of the gut. It is not pus or a sign of infection. Often, the pain with IBS is relieved with a bowel movement. So what causes IBS? The symptoms of IBS are thought to be due to a problem with how the brain and the digestive tract organs interact. This is also known as a disorder of the gut-brain interaction. This can impair the intestinal movement, leading to rapid or delayed transit through the gut. The brain processes pain signals from the gut differently, which can increase pain or discomfort that is felt from normal signals that the gut produces, or visceral hypersensitivity. Research has shown that people with IBS have discomfort from the normal stretching of the bowel that is caused by gas and stool. People without IBS are not aware of this normal stretching. In people with IBS, the colon can be overly responsive to even slight conflict or stress. Stress makes the mind more aware of the sensations that arise in the gut. Many environmental, psychological, and biological factors contribute to the symptoms relating to these functional gastrointestinal disorders. Certain foods, prior infections, and changes in the microbiome can also trigger symptoms. Normal movement of food, gas, and stool may not be present in someone with IBS. Slow motility can lead to constipation. Fast motility can lead to diarrhea. Spasms, or sudden strong muscular contractions that come and go, can cause abdominal pain. Some people with IBS also experience hyperreactivity, which is an excessive increase in contractions of the bowel in response to stress or eating. With mental health disorders, you can have altered levels of neurotransmitters, which are the chemicals in the body that transmit nerve signals. Neurotransmitters impact mood, as well as peristalsis, contractions and relaxations of the digestive tract that move food and fluid throughout the gut. This is why tricyclic antidepressants are used to treat some forms of IBS. The doses used to treat IBS are much lower than what is needed to treat depression, anxiety, or other mental health disorders. This is common in people who have a history of emotional, physical, or sexual abuse. Trauma can disrupt the stress response, leading to increased levels of cortisol, which lead to a heightened stress response. Abuse can alter the communication pathways between the brain and the gut. Research suggests that individuals with a history of abuse may experience more severe abdominal pain and other IBS-related symptoms, potentially due to the impact that trauma has on the brain and the nerves. It is not clear why some people develop IBS after a gastrointestinal infection and others do not. Women with IBS tend to have more symptoms during menstrual periods. IBS affects twice as many women as men. So how do we diagnose IBS? This is a diagnosis that your primary care physician is capable of making and treating. They will discuss your symptoms in detail to determine if you have IBS. Your medications and diet will also be reviewed, as they are commonly the cause of a change in bowels. Symptoms triggered by foods are not necessarily a sign of a food allergy. Blood work may be obtained to screen for other conditions that could cause your symptoms. Symptoms that occur in relation to stressful events are very suggestive of IBS. Although there is no cure for IBS, the symptoms can be successfully treated with a combination of the following: good sleep, exercise, diet, treating mental health issues, and therapies that focus on the brain-gut interaction, as well as medications and probiotics. Sleep disturbances are more common in patients with IBS and correlate with IBS-related pain, and sleep profoundly impacts neurotransmitter levels. Studies have shown that 20 to 60 minutes of moderate activity 3 to 5 days a week improves IBS symptoms. Consuming smaller, more frequent meals can help with symptoms, as larger meals can cause cramping and diarrhea. Avoiding foods that are high in fat, dairy products, artificial sweeteners, beans, and cruciferous vegetables such as cauliflower, cabbage, and broccoli. Insoluble fiber, such as wheat bran or brown rice. Your personal IBS triggers: alcohol, caffeine, and carbonated beverages. Stay well hydrated and increase your soluble fiber, such as psyllium, oat bran, and barley. You might try a low FODMAP diet if symptoms persist after successful elimination of the above. You can find information on this diet in the links below. Therapies that focus on the brain-gut interaction can also be very helpful. The following therapies can help improve IBS symptoms due to mental health issues: participating in stress reduction and relaxation therapies, such as meditation, getting counseling and support, taking part in regular exercise, such as walking or yoga, minimizing stressful life situations as much as possible, getting enough sleep, and cognitive behavioral therapy, hypnotherapy, or mindfulness training. Medication that targets the brain-gut communication don't exist yet, so IBS medications focus on treating the symptoms. Fiber supplements, such as psyllium, can relieve constipation when increasing dietary fiber is ineffective. This can also help with diarrhea. If fiber supplementation alone does not result in a bowel movement that is easy to pass every day or every other day, you can start taking 1 to 2 capfuls of Miralax a day. This is a very safe medication that is sold over the counter without any significant side effects. You should increase the dose until you have a bowel movement every day or every other day. If you start developing loose stools or diarrhea, you can decrease the dose. Once it is effective, you will be able to stop other stool softeners or laxatives. This preparation is safe to take long-term, even though the label may say that it is only for short-term use. I recommend avoiding Senna, Senecot, or Dulcolax, as all of these are stimulant laxatives and not long-term solutions, as you can become dependent upon them. It is okay to use these for 3 to 5 days a month if needed. You may need antidiarrheals like Imodium. You can take 2 milligrams of this 45 minutes before meals. The maximum dose you should take is 16 milligrams a day. This can also be given as a preventative measure before symptom triggers, such as exercise or stressful situations. Antispasmodics such as Bentyl help control colon muscle spasms and reduce abdominal pain and diarrhea. These need to be prescribed by your doctor and can cause constipation. Herbal remedies such as peppermint oil, IB Guard, FD Guard, Iberogast, or Heather's Tummy Tamers can all be purchased over the counter. Taking an antidepressant may help restore neurotransmitter concentrations. Probiotics are live bacteria which are similar to the microorganisms normally found in the GI tract. Studies have found that probiotics, specifically bifidobacteria, and certain probiotic combinations improve symptoms of IBS when taken in large enough amounts, though there is not enough data to recommend routine use. Culturelle, Visbiome, and Align are all well-known brands. These do not need to be continued indefinitely. Usually, I recommend that you try them for 30 days. Some final things you should know. Symptoms can resolve in a small subset of patients. Diets that are based upon food allergy testing have not been shown to be beneficial to people with IBS. Fecal microbiota transplantation, or FMT, is not recommended as results are inconsistent. There is no need to formally test for lactose intolerance. If you need to apply pressure with your hand to the pelvic floor to empty the bowel, it could be a sign of pelvic floor muscle weakness, and you may benefit from pelvic floor physical therapy. Successful treatment requires good communication with your doctor and a long-term commitment to addressing the multiple variables that produce symptoms. If you see blood in your stool, unintentional weight loss, large volume diarrhea, your symptoms begin after age 45, your diarrhea occurs in the middle of the night, you have progressive abdominal pain or have oily stool, a family history of celiac disease, inflammatory bowel disease, or colorectal cancer, it is important that you make an appointment with your primary care physician rather than just trying these interventions on your own. Your primary care physician can help you manage your symptoms or refer you to a specialist like me. Thank you for your time today.